Coming up on this episode of Healthy Longevity.
So let's talk about brain aging. There are so many people who have a fear of dementia and Alzheimer's, and there's real disease that I believe, like we can reverse and stop.
There is good data that's been out there published that shows that even with simple changes in diet and exercise and a few simple supplements, you can make a difference.
We know so little about health in our society because we wait for disease. It's all reactive.
The earlier you can identify that someone's at risk, the earlier you can get to changing their exercise program, their sleep habits, their diet.
How do you analyze data, recognizing that different folks need different strokes, and how do you guide them in that?
I'm very attentive in listening for clues that tell me that they're on the wrong pathway.
If you've ever misplaced your keys or cell phone, or forgotten the name of a friend you've known for decades, you've probably wondered, is it early dementia? Fear of cognitive decline is very high, especially among those of us who are aging. A few years back, an AARP survey found that nearly half of adults over age 40 believe they will likely develop dementia. And Alzheimer's Disease International reports nearly 80% of the public is worried about the disease. Are you? Hi, I'm Dr. Florence Comite, founder of Comite Center for Precision Medicine and Healthy Longevity. My new book, Invincible, Defy Your Genetic Destiny to Live Better Longer, publishes on April 28th. You can pre-order now from Amazon or your favorite bookseller. Brain fog, memory loss, and dementia are one of the 7 common patterns of aging I write about in my book because so many people are concerned. And there are steps you can take today to minimize your risk. On today's podcast, I'm delighted to welcome one of the leading experts in the field of brain longevity, board-certified neurologist Dr. Shelly Jordan, who's visiting with us from Santa Monica, California, where he has a private practice, Neurological Associates, the Interventional Group. Dr. Jordan is also the founder of the Regenesis Project, a clinical research initiative focused on advancing brain health, neurological regeneration, and interventions that target the biology of aging and neurodegeneration. Shelly, thank you so much for joining me on Healthy Longevity. I'm very excited to have this conversation with you, and I can talk to you for hours, as you know. Lots of ideas, and I think we're synergistic in the way we look at the world.
Totally.
I forgot to mention to our listeners when I introduced you that you're also a prolific photographer and a visual artist. What mediums do you mostly work in? What do you like to do?
Well, right now I'm doing a lot of digital airbrushing, and I use the images as educational materials in a lot of the talks that I do. And, it all started with crayons when I was 4 or 5 years old. And, as the digital age has come upon us, I've taken up other media. I have to be an artist to be able to communicate on some level. And, some people are particularly driven by images.
I think there's a cognitive benefit to creating artwork and music. I think that a lot of doctors have both of those skill sets, and I think they feed upon each other. It's a great tool. So let's talk about brain aging. That's really what's so exciting about the fact that there are so many people who have a fear of dementia and Alzheimer's, and there's real disease that I believe, like we can reverse and stop and the decline. And I think the pressure on us as a society, as individuals, economically, and in terms of quality of life is humongous. And so if we could do something about it years or decades even before anybody expresses symptoms, that would be miraculous. So I'd love to learn a little bit more about how you've approached it over the years.
Well, that's one of the main reasons why we're here. We want to work with you and bring some of this material to your patients, because really there's a lot of things, I wouldn't even call them experimental. There are things in terms of supplements and repurposed medications, certain aspects of diet and exercise that make a difference. And there is good data that's been out there published that shows that even with simple changes in diet and exercise and a few simple supplements, you can make a difference. You're familiar with the article that was done by Dr. Ornish out of UC San Francisco. I know.
Familiar with Dean, very familiar. We've known each other for 20
Dean.
years. Yeah.
It's a brilliant article. And simple things where you could show that patients with early cognitive decline, you could stabilize them with very simple things, no side effects, and they do much better than people who are just treated in the ordinary fashion.
Mm-hmm. Agree, and I'm totally with you. I think that we know so little about health in our society because we wait for disease. It's all reactive. That's what doctors are used to doing, treating disease, not looking proactively. So that is a love of mine, and why I decided to do what I did is N of 1 precision medicine, get the data and work with people in a way that's specific to them with outcomes that are measurable.
I think that's a hugely important stance to take. All too often, I've seen the following situation, is that you'll see a patient who's had problems remembering people's names or where they parked the car, or where they left the keys, and they'll see their primary doctor, and their primary doctor or their neurologist will say, well, it's just normal
aging,
memory loss that you get with aging. Mm-hmm. Yeah, don't worry about it.
Right.
Everybody has it at some point. And that's really unfortunate because once you start losing nerve cells, they don't really grow back. So the earlier you can identify that someone's at risk, the earlier you can get to changing their exercise program, their sleep habits, their diet, supplements, and there are many, many supplements from melatonin to many others
lion's mane,
that have lion's mane,
right,
that have actually good data behind it, that all you have to do is read about it and figure out what people need. And we don't have to guess that anymore. With advanced imaging and some of the serological testing, we can tell if people have inflammatory problems. Do they have chronic viral infections? Do they have a leaky gut? Do they have mold exposure? Do they have problems with their diet that can be corrected? There are so many things that can be identified and changed at an early stage that can stabilize people. The data is there. Just a matter of spending the time. I don't think a lot of doctors, unfortunately, have a lot of time to really pay attention to this because some of it's like social engineering almost, like how do you change a diet? How do you change sleeping habits? How do you do all these things? It takes time and effort, and I think that's why the work that you're doing is spectacular, because you'll take the time with your patients who are highly motivated, but they have to have the direction. They have to have the coaching. They have to have the monitoring to make sure we're making an impact. But if they do that, it's really worth it.
I completely agree. And I think it is about time. I remember 20, 30 years ago when I started this work, it was like, I need to know more about you, the patient, in order to make changes. And then you have to dig in. And pretty much in the same era, we didn't get anything about nutrition or exercise or sleep. And it's vital to the aging person in any level, 20, 30, 40, 50, whatever. And so I think that we're both on the same page in that way, but it takes effort. But really, it's so little is understood, and the doctors don't know, and the general population knows even less. And much of it nowadays is coming from TikTok or social media, which is not.
Or it's coming from big pharma,
right? Who had the drugs to.
Some drug company spends $2.4 billion to provide a new drug out of their pipeline, and there's a heavy marketing. So the doctors hear all about that, the patients hear all about that, and that's what they're on. Not because it's necessarily more effective than things are already out there, but because they have the marketing power.
It's a problem because it's driven by financial gains, and each quarter they need to prove to their stockholders that they're doing okay. And you're absolutely right. And just basic facts, I'm so blown away. The book that I've written, Invincible, Defy Your Genetic Destiny to Live Better Longer, to me is giving these tools to the hands of the patients and people, everybody, doctors included, because it's the basics that we don't get. And possibly because there are so many sick people, time is of the essence for doctors. We tend to be siloed into our specialties, and we look at things with blinders. For example, thyroid disease, which I see in which affects the brain. As you know, 80% of patients come in here and have been misdiagnosed because they only get a TSH, and you can't check a free T3 and a free T4, and it's disconnected. And I think the aging brain does that. The brain thyroid mechanism feedback loop is not operational effectively as people age in a
That's
large
right.
group
So
of
the biological
population.
clock of aging also handles the rhythmicity of our hormones.
Nowadays, I look to see, and I think there's one central truth I've seen, and I just read a few articles about that as well that seem to be coming to the forefront about the role of sugar in Alzheimer's too, and the fact that
Huge.
it used to be called diabetes type 3. But I believe sugar is a runner of all the diseases of aging.
Here's a really interesting story we got to talk about.
Yes.
So Alzheimer's disease is virtually unheard of before the late 1800s. So there are plenty of medical type texts and accounts over, hundreds of years. Not much mention about dementia. Of course, in the 1800s, you did have syphilis, which is a separate phenomenon. Doesn't look like Alzheimer's disease. But there's very little Alzheimer's disease until the availability of sugar. So sugar cane and sugar beets, late 1800s, early 1900s. So people didn't have access to candy or syrups or purified carbohydrates. And it's
Corn
around
syrup, fructose, everything added to every food.
They weren't they weren't available. So suddenly it's available, and the first cases of Alzheimer's disease are reported really around the turn of the century.
Which
and
century?
since then,
1900.
From 1800s to the 1900s, right? That's when the first cases became apparent. And there's just been an amazing acceleration of Alzheimer's disease. So the availability of carbohydrates is definitely a problem. And the reason that happens is that when there's a sudden blast of sugar, because you're taking a refined source, which gets in your bloodstream very quickly, there's a spike in sugar. What happens, the cells in your brain suddenly get exposed to too much glucose. And that turns on a need to suddenly get rid of all of this glucose that's now flooding a cell. And that produces basically toxic byproducts. And that damages a cell. So it also damages the endothelium, which is the conduits of blood to the brain. So once you take that element out of the diet, that's one of the most important things you can do. You could probably reduce your chance of a progressive cognitive decline.
Well, we believe very strongly in wearables because I feel that it gives people control. So we've been using continuous glucose monitors.
Absolutely.
I have never put someone who presents, and almost everybody does present, with abnormal glucose metabolism. I actually don't even call it diabetes type 2 anymore. I call it a disorder of carbohydrate metabolism because every one of us has it. In part, I think, due to inheritance. We only survive people who survive famine from cavemen on, cave women, the Holocaust, the Irish famine. And as a result, with bad food and the fact that we're geared to survive, every single one of us is on that path. So aging comes along with diseases unless we take control. And the continuous glucose monitor, for me, has been a total game changer for everybody. We try to keep it tight because I don't believe sugar is evil. I have a sweet tooth. But I believe if you can take control of it and you know how it affects your body.
So insulin in the brain is particularly interesting as well. It's not exactly the same as insulin in the body. So insulin in the brain is not necessarily required to get sugar, glucose, into cells like it is in the rest of the body. Insulin is basically a trophic factor. It keeps the nerve cells living and it maintains their integrity. And if you develop insulin resistance at the brain level, it's one of the things that can predispose to a deterioration of nerve cells. Now, fortunately, you can work with that by changing your diet, but also things like nasal insulin actually have multiple studies now that have demonstrated that can actually be very helpful in people with early cognitive decline. The question is identifying those people that have actually insulin resistance at the brain level, and that could be done with advanced imaging, for example, so we don't have to guess at that.
We actually address it, and I have worked with GLP-1s, which I also think are the antibiotics of the 21st century. Because I've seen these changes independent of weight loss. And so having used it for over 20 years, that's part of our goal. We don't image the brain for insulin, so that would be, great to be able to do that. Now, I think you already mentioned on the influences of aging, and that we know everybody is unique. How do you analyze data, recognizing that different folks need different strokes, and how do you guide them in that way? Do you have a general plan, and then you specify, exactly what actionable interventions may be precise for you versus me?
I'm sort of old-fashioned and new-fashioned at the same time. So I actually talk to my patients, as I'm sure you do.
That's amazing, yeah.
So I'm very attentive in listening for clues that tell me that they're on the wrong pathway. So if we're looking at neurology, I want to know, what's their sleep? Are they waking up in the middle of the night?
No.
Do they act out their dreams? Do they have problems with breathing at night? Because all of those are a harbinger for bad things to happen from a neurological degeneration standpoint. I'm very interested in their everyday life. Do they forget where they parked the car? Do they forget where they left the keys, their cell phone? And then I want to know, can they remember the right words to say? Do they have to talk around it? Do they have that tip of the tongue like, I know what that name is, but it's not coming?
Right.
So I listen to those little clues that tell me that something's happening. And nowadays we have blood tests, we have advanced imaging that can allow us to look into the brain and identify those people that are really at risk. So genetics, very important, obviously. There are some that are fairly simple, like the ApoE4. It's a high risk factor for a progressive Alzheimer's-like condition. But there are many other genes that you can look for. Now, some people will say, well, I don't want to know. I'm just going to worry. What can you do about it? It turns out that, in my belief, everything is treatable. So if you have ApoE44, which is a high risk for a progressive Alzheimer's condition, a lot of that can be neutralized by taking certain kinds of supplements, like the plasmalogen precursors and the omega-3 fatty acids. So if we're proactive, we can keep those nerve cells functioning for a very long time. If you ignore it, you'll get to a point where those nerve cells die, and once the nerve cells die, they don't regrow. So
that's an interesting comment. You just said that earlier. And coming from not the brain itself, but nerves themselves, I know there's a whole series of women, for example, who in the old days would be treated with mastectomy and stripping the nerves, particularly if the sentinel lymph node was positive for cancer. And for 2 years or so, they had terrible arm pain and discomfort. But then I always was under the impression that it takes a very long time, but you can regenerate nerve cells. It just takes, they're the slowest growing, recovering part of the body. But you're saying that there's no way to recover nerve cells?
What's happening there is a regrowth of the terminal portions of a nerve cell.
Oh.
But if you cut out the cell body, they won't regrow.
They won't regrow.
So if you look at something like Alzheimer's disease, if there's something happening at the genetic level or at the gene to translation to protein level, things will shut down at the nucleus and the cell will die. So it will not grow back. That's a little different than looking at the end terminals.
I see. Okay,
but when it comes to central nervous system cells, if you shut down protein synthesis, so there's something called the integrative stress response. So if a cell is being buffeted in some way by a challenge, like inflammation in the body, the ability to translate a genetic code into a protein product is stopped. And that may never turn back on. And so what happens is the cells can't make the proteins that it needs to keep itself going, and it'll just die. In that case. So what we have to do is intervene to prevent that from happening.
Totally. And returning to the topic of sleep, which I actually think trumps food and sugar, because you can't cleanse the nervous system, you can't cleanse the brain. I've been reading a fair amount about lymphatics and being able to circulate, a very special process that goes on during deep sleep. Many people don't have deep sleep. There too, we use a lot of wearables. We try to extrapolate trends because, like you, it feels like we were trained in exactly the same way and our minds worked in that direction. I talk to the patient. I want to understand where they're coming from, what they're doing. Probably not as deep with respect to brain, but making note of how they're actually living life. Do they have relationships? What are they doing in terms of sleep, food, exercise, restorative practices like meditation, and how we can gently change that path.
So sleep, deep sleep in particular, is where you clean out the toxins.
Yes.
So deep sleep, you think, is not a good state to be in if you're that caveman or cavewoman you're talking about earlier. You can imagine if a pack of hyenas is attacking you, deep sleep is not where you want to be. Right. So there's probably...
Or you want to be deep in a cave with no access to the hyenas.
Yeah, with a security guard at the entrance.
Exactly.
But I think the problem is that deep sleep, even though it's a risk to go into that state, it's so important. It does one thing very well, and that's get rid of toxins. So the spaces, the interstices between cells opens up during deep sleep. So this flushing action can take place. So these particulate matters and small molecules, large molecules can be cleared out. And if you don't ever go through deep sleep, you'll never clear that out, and there'll be an accumulation. Now, here's where things really go badly, is that the accumulation of these proteinaceous toxic waste dumps turns out to accelerate the degenerative process. So we want to intervene in an early stage. Wearables are a good way to start. Formal sleep studies, when necessary, also important. But you want to make sure that someone has at least an hour of deep sleep. If they're not getting an hour of deep sleep, they're not clearing out the toxins. Mm-hmm. Now, before I cheated and reset my biological clock, I was only sleeping deep sleep 15 minutes, which is not nearly enough. Now, with resetting that clock, I'm sleeping an hour, which is probably sufficient to clear out the toxins. Then it makes a big difference.
What total amount of sleep do you get?
Total amount of sleep that I get now is probably about 7 hours, which isn't bad. But it's you can sleep 7 hours and have useless sleep.
Oh yeah, we've had people sleep 9 and 10 hours and have no deep sleep. Those are people that wake up and say, "I don't feel rested," and I worry about that. I'm the opposite. And there are people who are the opposite, where they get 2, 3, 4 hours and they get an hour or two of deep sleep. And the energy's there, but what you lose is REM sleep, and what you lose is your ability. So you can function great. I can function great. I think it was our training as a resident. My whole family can sleep. My mother used to say that my twin and I would sleep 12 hours a night at 5 years of age and take 2-hour naps. So sleep has always been bred into my fiber and my DNA. But I noticed when I cut back on sleep, because I was creating something or very too busy to go to sleep before 1, 2 in the morning, and then I'd wake up at 4 or 5, that I lost my ability to be creative. And I forced myself to go back to a minimum of 6 hours, where I always get at least an hour of deep sleep, sometimes more. And I get a lot of REM now. The dreams are overwhelming sometimes, but to some degree, and I've read a lot of theories about this that don't agree, I feel that you can make up for sleep. You initially have a hard time, but and you get sleepier when you've lost a lot of sleep. But then after a while, and I don't know what you think about it as a neurologist.
Well, you need the deep sleep. So the duration of sleep isn't, in my mind, isn't as important as the quality of sleep. So if you can get an hour of deep sleep and an hour of REM, you're doing pretty well. So you add those together, that's only 2 hours. So the light sleep is probably not as important as anything else. It's
annoying, the light sleep. I'd rather be in deep sleep or
you want to
REM.
be in deep sleep, and you need REM. So deep sleep is for clearing out the toxins. And I think the best way to characterize REM sleep, which is dreaming sleep, or most of the dreaming sleep, is that it helps you process emotional content. And I think people are emotionally better off when they have at least an hour of REM sleep.
I've noticed that. Plus, I think when you don't get sufficient quantity of sleep, quality, I completely agree. You're also secreting other kinds of hormones between cortisol, ghrelin, and it changes the way you want to eat and changes the way you want to live.
Totally. You have to really, an ideal sleep would be probably somewhere between 6 and 8 hours with an hour of deep, an hour of REM, and then enough time for these hormones that happen during night to cycle through.
Exactly.
The rhythm is critical. So you can't replace hormone cycling by an extraneous source, and you know that. So if you give testosterone or if you give estrogen or whatever, you make up any hormone you want, and you just give it as a deposit or you give it as a pill or shot or whatever, you do not recreate that natural rhythmicity that is really important, because there has to be a correlation between when the hormones are released and when the peripheral tissues are ready to receive that. There has to be a synchrony there. So the clocks are not just in the brain, they're also in the peripheral systems, and they have to be in sync.
Yeah, so this is absolutely fascinating to me because I've spoken many years on this topic. When people talk about recreating and replacing hormones, I really don't like that term because there's no way to replace hormones. And I give examples of, look what happens to estrogen during a natural menstrual cycle. The average estrogen over a month could be 90 or 80 because when you ovulate, it goes high, but you can get castrate levels in the first week. So it's not restorative. So the way I approach hormone optimization is by looking at risk benefit for each person and then determining what do we need to get all the factors working together. Because you do need the hormones, they work in a certain particular way, but you're not going to recreate Mother Nature. You're going to optimize the person to the best of your ability by looking at all these other factors. And I'm completely with you about sleep and about food, and we could probably get to exercise and probably say the same thing, or restorative treatments. Like I like, for example, meditation or breathing work, because I think you can actually reduce cortisol if you actually meditate effectively. Qigong is another aspect of it that I like, but every person's makeup is different. And so you can't, even partners and identical twins, there's different approaches for each person that depends on their total body makeup and their profile.
That's for sure. But, I'm interested in your comments about the hormone replacement and not being able to duplicate nature. I think the way to duplicate nature is to engage the biological clock in the hypothalamus, which actually gives you that rhythmicity. It's very hard to recreate that by an extraneous source of hormones because every hormone has a different time clock. And so if we can restore that central clock, I think you're going to a great distance in getting someone back to a younger physiology.
I think you can having worked with hormones for over 30 years, because my deep training and love was looking at what hormones do at every stage of life. There are ways, for example, in men to use testosterone, and we measure the levels so that we can get some rhythmicity to that. So the way men secrete hormones, because they end up interrupting, they go through male menopause or periandropause and andropause, and a lot of doctors don't even believe it, but of course they decline in the same way. And you can make more testosterone if you work out harder. Growth hormone, yes, but not testosterone. So the way we look at testosterone, is just one example, is we make sure the levels are adequate enough and go up and down, don't stay exactly the same. So at least you get some pulsatility. And I think the body and the brain recognize that. It is not what you are when you're 25, but we can recreate that average level over time. And that's the way we handle estrogen in women. So as women begin to change in their 30s and 40s and their ovulation patterns decrease and they have a lot of estrogen, sometimes they ovulate, sometimes they don't have progesterone, we will add progesterone to the mix, which is supposed to be halfway through the cycle. If you ovulate, let's say day 14 or 14 days before your next cycle, on average, everybody's different. It could be 10 days, it could be 7 days, it could be 20 days. We add progesterone, and then as women enter the perimenopause, closer to menopause, when they actually stop cycling, we layer on the other hormones, including testosterone, which we sometimes start as early as the 20s, because young women on birth control pills don't have enough testosterone. Right. And that's the hormone that's the most active and the highest amount in women's bodies, even though it's not even approved for use in women. I've been prescribing it and using it myself for 30 years because of high risk of osteoporosis, and I've kept my bones completely stable, even though both my mother and father and lots of relatives had osteoporosis. So I agree with you. You can't recreate the natural cycle that Mother Nature gives us. Some of us, not all of us, but you can induce a kind of stage where they're seeing hormones in fluctuating amounts over time. So that's one way to think about it, but I'd love to have more conversations to hear about it from the brain perspective. Because testosterone to me is critical to the brain. I've had patients, I've been shocked over the years, that I think are close to dementia, You can tell by the way they treat us. They forget things. They get angry. Runs in their family. They have ApoE4. They think there's no appointment, and they rush in, and there may be one, and they didn't know. And within months of initiating testosterone, with verbal kind of recognition of it, their memory returns. I have some very well-known people who come in with that.
No, I totally get that. Now, and some of it's perhaps direct, but some of it's also indirect. So if you're able to maintain good muscle function and muscle mass,
yes,
it turns out that muscle is like the biggest organ in your body. And
they think of it sometimes as the organ of longevity. Because without it, you can't pack away sugar. You can't maintain your strength. But testosterone is it starts with muscle, but it affects cognition. It affects the heart. It affects every aspect of performance.
That's what I was going to say. So there's an enormous relationship between loss of muscle bulk, so sarcopenia,
right,
and dementia. They go together. And part of it has to do with the fact that muscle is one of the main producers of brain-derived neurotrophic factors of various types. So
muscle systemically affects brain-derived.
The muscle produces different trophic factors that is required for maintaining cognition.
Wow. So we agree, sarcopenia is absolutely a negative, and all of us will get that unless we actively work to reverse it. Enough protein. Adequate protein in terms of daily protein intake, at least 1 gram per kilogram per day, or even more if you work out hard. Resistance training, so you're putting on muscle. Sometimes I have people in amazing shape aerobically, but they have no muscle. And then finally, testosterone, because it's very hard. I've seen 2 exceptions to this in my entire career of thousands of patients who are not on testosterone. Sometimes they take DHEA, which converts. It's a pro-hormone. It acts a little bit like it. But for the most part, without testosterone, you can't maintain muscle. You're going to get weaker and weaker. It's like the cachexia of cancer or AIDS. You're not going to be able to maintain muscle. So I too believe very strongly.
Tune in to part 2 of Healthy Longevity with special guest Dr. Shelly Jordan.